Hi everyone, we're here with Nutri Advance, and today we're going to be talking all things gynae, from PCOS to fibroids to endometriosis, and we're also going to be challenging and breaking the stigma associated. So join us in on this conversation. Really excited. So Oghosa, for those who don't know, could you tell us a little bit more about your condition?
Sure. So I have fibroids. I'm trying to remember how many I have. I think there's about 4 or 5 at the moment. And fibroids are basically, they're like non-cancerous cells in your uterus. They can be positioned in different places in your uterus. But unfortunately, mine are in the cervix. A lot of women have fibroids, but the positioning of them makes the difference to your health. And for me, yeah, that's what's made it quite difficult.
Can you tell us a little bit about the symptoms that you had to begin with?
At first, I had really long periods, painful periods, and then progressively it got worse and worse. So, yeah.
Okay, well, we could talk about fibroids in depth in a second, but I also wanted Sare to tell us a bit about your condition.
Yeah, so I have polycystic ovary syndrome, which is a hormonal condition that affects the ovaries, and it just means that the ovaries produce more androgens than normal. Some of the symptoms of polycystic ovary syndrome are irregular periods, facial hair acne, infertility, painful periods.
So you can actually hear from both of what you're saying, there's a similarity with regards to symptoms. And this is the thing when it comes to gynecological conditions, that it's hard to pinpoint what is what. And that's why it's really important, and why I want to emphasize here, that you get your symptoms seen to as soon as possible. You shouldn't be suffering in silence. You shouldn't be experiencing painful periods. You shouldn't be having irregular periods. If that's something that's different, go and see your doctor. And if you're struggling with it, you see your doctor. But when we talk about fibroids, just like what you just said, Oghosa, and you described it really well, you got a medical degree. No, but it was really good. I want to sort of give you a visual demonstration. But before we start, do you guys know what this is?
Ovaries, uterus, vagina.
Yeah. Yes. It's basically the female reproductive anatomy. Brilliant. So I'm going to point to things and you guys tell me what they are, okay? Sare, what's this?
Ovaries.
Ovaries, exactly. So yeah, the ovaries are the glands that produce the eggs. They hold on to the eggs and then they release them every single month. And also they produce the sex hormones, estrogen, progesterone, and the male sex hormone, testosterone. But it's usually only in a small quantity. However, in people with PCOS, you produce a lot more, and that is what causes the hair in different places that you don't usually associate with women. So in the chin, on the chest, on the tummy, and also it's what causes the acne as well, okay? And then what do you think these are on either side, Oghosa?
Fallopian tubes.
Yes, fallopian tubes, right. So when the ovaries release the egg, it travels up the fallopian tube and then down into this big area known as
Uterus.
Yes, the womb. So you were talking about fibroids, and fibroids are basically, like you said, non-cancerous growth within the womb, in or around the womb, and there are different types depending on where they're positioned. So the inner area, the inner wall of the womb is known as your endometrium. So that's the area that lines and it thickens throughout the month. And then it also sheds by the end of the cycle, which is, well, the start of the cycle, which is when you have your menses, okay? When you bleed. And so if you have fibroids that occur in this area, they're known as submucosal. If you have fibroids that occur within the muscle itself, it's intramural. If it's on the outer aspect, it's subserosal. And also you can have what's known as pedunculated fibroids. So that's where you have like a little stalk and then the fibroid coming out, okay? And then you have this little area that often looks like a donut when it's visualized by the doctor through a speculum. Do you know what
cervix.
that is? Yes, this is cervix, yeah. And you mentioned that the cervix is the area that your fibroids are predominantly.
So there's some in the cervix and there's some in the
Neural. Okay, so there's some inside the muscle. Okay.
Yeah.
So the cervix basically is the neck of the womb, okay? And it's kind of it's a canal that connects the vagina to the womb, okay? And it's also the bit that sort of keeps closed so the baby stays in. It also produces some lubrication and so on. And it is crazy because when you look at how small it is, it can dilate to 10 centimeters, and that's where the baby comes out. And then you have this area, which is known as the
I'm lost.
Vagina?
vagina.
Oh, right.
Yeah,
I feel
vagina.
like we associate that with the outside of what it is rather than the inner part.
Yeah, and you know what? It's so important that you said this because that is such a common misconception. So the vagina is inside. So vagina has the letters in, to remind you, vagina, in, okay? So it's a muscular canal that basically it allows a lot of things in. Some things are fun. And it's also where a lot of things come out as well. So the blood during your menses and also the babies and so on. Nothing goes into the vagina, just to say, because there are loads of people who douche or put these products inside, hygiene products. You don't put anything in the vagina. It has its own pH balance, its own balanced environment. And the moment we start putting things in, it messes it up. And I just wanted to show this picture because you've mentioned it. This aspect, do you know what it's called?
Well, the pink bit I know is the vulva. Oh no, the labia. Well, there's the labia and the vulva. So it's like connected. But that's what people associate with being a vagina. Do you see what I'm saying?
Exactly. So actually, this whole bit is the vulva.
Okay.
So the vulva is the external female genitalia. Okay, and it has these different parts, and the vaginal opening is just that bit, and the vagina is inside. So all we can see is the opening, really. Yeah. So it's important to know the difference. And then that is the clitoris. So that's just part of the clitoris. The whole clitoris is actually, it's not this big, but this is like a little model. That's the only bit we see on the outside. Everything else is on the inside.
Yeah, because it's like a muscle.
Yeah.
When I was younger, my periods were super heavy, and then by the age of 17, I'd started to grow facial hair, and at that point, it was just very light and wispy, and obviously, I was like, "What is this?" So then my mum took me to the doctors. I had blood tests and an ultrasound scan and an internal scan. And it came back that I did have polycystic ovary syndrome, but I didn't have any cysts on my ovaries. I just had the levels in my blood were not normal.
And I love that you guys are talking so freely about these conditions that are so common. So in regards to fibroids, it's 1 in 3 women.
Yeah, it's so common.
In the lifetime. In regards to PCOS, it's 1 in 10. So it's very, very common.
I get a lot of feedback from people and they are like, oh my God, I thought I was the only person with this problem, because the one symptom I talk about a lot is facial hair. And a lot of people ask me, how do you live with the symptoms and how do you go about getting a diagnosis? So I explain to them, definitely go and see your GP and make sure you push your GP for the answer that you're looking for, because they don't really understand it, and you won't.
And they're not specialists sometimes.
No, and you won't really get an outcome.
So when we talk about PCOS, insulin resistance is one of a common problem with PCOS, and essentially what happens is, do you know what insulin is? It's basically a hormone that's produced by a gland called your pancreas, or organ called your pancreas, and essentially it controls the blood sugar, right? It makes sure that it's stable and it's within a normal range. So it acts as a key that opens up so that the blood glucose can go into the cells. So the cells...
A-level biology, it's coming back to me. It's coming back. I even remember the diagram. I hated those lessons. All right, go on.
Charlie.
Well, you loved them, so it's fine.
All right, no. So yeah, essentially it acts as a key that opens up the cells, it gets the glucose in so the cells can utilize them, and also so that they can then store them, essentially, right? So what happens in PCOS, the cells aren't as sensitive to the insulin, so they're not able to push the glucose in. So then you have more insulin being produced, and it ends up just being a vicious circle, because more insulin is being produced and not much is going in. When it does go in, it gets converted into fat, which then encourages more insulin resistance, and it's a vicious circle.
Controversial, but I think there are some systemic issues within the NHS, and because of that, it causes this pushback, and you don't get the help that you need. Me being a black woman, it's like racism and sexism. Like, one nurse literally didn't want to give me more morphine because she thought that I could handle the pain, but I was screaming out in pain after my surgery. and a black nurse came over and she was like, don't worry, I'll give you more morphine, and she upped it. But I would definitely advise people, especially black women, to, yeah, as you said, push back. Like, and sometimes it feels unnatural or uncomfortable because you don't want to be like the angry person, or you don't want to be the angry black woman, or you don't want to be that stereotype. But it's your health. You have to fight for your health. Like, out of everything we have in this world, I think your health is the only thing that's yours. You know, so that's the advice I would give. And as well, like, yeah, seeking like comfort in your community, like speaking to your friends about how you feel. A lot of my friends have taken their gynecological health way more seriously now when I started speaking out about this. So yeah, finding solace in like your support network and stuff.
Absolutely.
From a medical perspective, how do you encourage those suffering from PCOS or fibroids to deal with the symptoms?
I would genuinely say, do what works best for you, all right? Definitely, please go and see your doctor as soon as possible, as early as possible. And it's good to get a diagnosis, as in your case, but then ask what's next. You know, like I said, ask questions, ask what's next. And then they may give you a list of options. Even if they don't, you could present them the list of options that you've done research about, that you've been empowered with the knowledge about, and then you can try what works for you. I think what's really important is that there's some patients, for instance, who try something and they try and stick with it, and then they're suffering and it's not working. And you go on, kind of like your story, you go on for months and months and months and months, when actually we could have tried something else in between, because that's not working for you. And then you have some people who, oh, well, it didn't work, I'm not gonna try anything else. You know, don't give up. Definitely try the different options. Tell your doctor if it's not working. Tell your doctor if you stop taking it, because again, we just keep prescribing it if we don't know, if we're not aware, we'll keep prescribing the medication thinking that you're taking it. And then, you know, for instance, if you had fibroids and we put you on the pill, and then months down the line, you've been bleeding heavily for so many months, you come back being extremely anemic. I'm like, what is going on? But we put you on something, you know? So it's those little things. And yeah, just keep asking questions and keep advocating for yourself, because just like Oghosa said, your health is literal wealth. It's the most expensive thing, currency that we have.
I'm not against the holistic approach, but I was saying this earlier, I grew up in a very red meat, very chicken. My dad's a pescatarian, chicken and fish household. I still got fibroids. Yeah. It's not this whole thing of, oh, like you're taking red meat or you're eating junk food. I exercise 5-6 times a week, which really is the maximum at this point. Like, do you know what I mean? I have such a healthy lifestyle, but I still had them. And I think people, as we were saying, like people kind of maybe use nutrition or
100%.
to justify it, to be like, oh, well, if I eat all of these things, then I'm never gonna get what she has. Like, it might be fear-based of like, she did that and so that's why it's happened to her and it's not gonna happen to me. Victim blaming, almost.
That's what I was gonna say. Like, it's so sad that people genuinely believe that certain patients or certain people have conditions because it's their fault. PCOS is not your fault. Fibroids is not your fault. There are genetic elements. If you have a family history of fibroids or even PCOS, you're more likely to get PCOS. So
yeah, and I usually get a lot of comments like, you know, it's because you're fat or lose weight, and it's like, my symptoms started when I was skinny, so do you know what I mean?
And it's the PCOS that is making you gain weight, and it's so hard to lose weight because of the PCOS. So there's a lot of work we need to do, but these conversations are so important.
Yeah, and like even as you're saying, like people responding with like positive comments about how they've gone to get checked up. Like someone even responded saying that they've gone to give blood because they didn't realise that so many different things can cause you to need a blood transfusion. And I think also I made blood transfusions quite real. As I was saying, like you think that you, in your head, you thinking about someone who needs a blood transfusion. It could literally be the person next to you, like could get sick next month, like you don't know.
It's so important to know your normal, know what is normal for you, okay? And you can really only do that by doing your self-checks, and that includes examining your breast, your pecs, your chest, examining your skin, and don't forget your hands, your nails, looking in your mouth, and also examining your vulva. So I did a reel on this recently, and so many people didn't realize that they do need to check their vulvas at least once a month if possible. And the reason being is, with all of these checks, is if you know what's normal for you, as soon as even the tiniest change happens, you will spot it. And the hope is that if it is anything sinister, which is rarely the case, then it's picked up early, it's hopefully diagnosed early, where treatment is much more likely to be successful, curative, and less invasive.